Hey friends, Avi here. In today's video, I want to tackle the 5 biggest myths surrounding back pain. As adults, most of you will experience some form of pain at some point in your life. Therefore, the mindset and belief you have regarding this pain will help determine how quickly and how well you heal. I'm addressing mechanical back pain. If you have sharp shooting pain running down a limb, if you have disturbances in your bladder or bowel associated with your back pain, or if you have loss of power and sensation in an area related with your back pain, then I suggest you seek immediate medical help. Actually, watch the video first, then seek the help because it'll help you once you recover. Let's tackle these myths. Myth 1. You should take it easy if your back is sore, or you should rest in bed. Now, there may be some instances where rest is needed. However, these are in the minority of cases. Bed rest can even aggravate your back symptoms as they would weaken the structures related in supporting the back, and this can affect you later. If you are injured or if you experience pain, you can still rest actively, where you are avoiding the pain-provoking movement, but still being active in moving in other areas and other mechanisms. Let me give you an example. Let's just say you hurt your back lifting something heavy. Instead of doing a weighted squat, which aggravates your pain, you can do a modified bodyweight squat or even lunges or any movement for your legs that does not aggravate pain. I get it. Exercise or movement can be sore initially when you have back pain. But the current literature shows that an exercise program with progressive overload yields the best outcomes in managing back pain. Myth 2. All back pain needs to have an X-ray or some form of imaging. The use of imaging is really useful in certain conditions. However, it may not be indicated in most conditions. Furthermore, X-rays do not determine or indicate the severity nor the prognosis of one's back pain. Pain is far more complex than that. In fact, in clinical practice, I've seen patients with no abnormality on X-ray that have severe pain. And on the flip side, I've seen patients with horrendous looking scans that are completely asymptomatic. Recent studies show that people that have unnecessary scans end up having more fear associated around their pain when they hear words such as degeneration, spondylosis, arthritis, disc bulges, and this can result in poor treatment outcomes. Myth 3 is that all back pain is serious and will worsen with age. According to medical literature, less than 1% of back pain will be caused by some serious injury or disease. While there are physiological changes as we age naturally, an increase in pain should not and is not one of them. Often, flare-ups of back pain are related to inactivity, poor lifestyle, stress and weight gain rather than aging or tissue abnormality. Myth 4. If you have a slipped or herniated disc, you will need surgery. Now, surgery and interventional procedures have a limited role in the management of back pain. However, they should not be the only management when it comes to managing herniated or slipped discs. In fact, studies show that people who had disc bulges or herniated discs and were symptomatic were re-MRI'd 6 to 12 months later, and their scans showed significant improvement. Most back pain will last between a course of 2 to 12 weeks. So make sure in that time you approach it conservatively before deciding you need surgical intervention, unless you have those symptoms that I discussed at the beginning of this video. And last but not least, and my personal favorite, myth 5 is that back pain runs in my family and I will have back pain because my parents had it. Well, if you have back pain, it's probably because no one runs in your family. Members can adopt a similar mindset because at one point they share a similar environment. Back pain is not genetic. At some point, most of the population will experience it. I hope this video tackles some of the myths that you may have had regarding back pain. If you enjoyed the content of this video, please leave a like or hit subscribe if you haven't already for more content that helps you to be the best physical version of you. In closing, I want to say our bodies were designed to heal itself. If we maintain an active lifestyle, make good lifestyle choices in terms of nutrition and weight, and manage our stress levels. If you found this video useful, please share it with friends, family, or anyone who may have experienced back pain. And that's everyone. In the meantime, I hope you all stay safe and stay strong.